Bismillah ar-Rahman ar-Rahim. I used to do this session for the medical students who are joining the medical college or medical school in US, and I think it is a very helpful uh, session to guide them what to expect and what to learn in the initial few years of medical college. So as a medical student, you have to make certain choices after every few years, like what's gonna be the field you're gonna choose after your MD or MBBS, and what would be your specialty of choice if you want to do any subspecialty training, and what you look into in terms of your balance between professional and social life. So I usually tell my colleagues and patients that there is three things. One is physical you, one is the psychological you, and one is the spiritual you. So you have to keep the balance between these three, between the physical, psychological, and spiritual part of you. When it comes to the physical part, you have to keep the balance between your social life and your professional life. And even as a consultant, I can tell you it's not an easy art, and this comes with time and experience, and everybody has to find their own fine balance. So I'll just try to give you a little input from my perspective, and you can decide based on your orientation. But I think the most important thing what you need to know or learn in the first few years of medical school or medical college is what type of personality that you have, because that will be the key factor that will decide what kind of subspecialty, specialty you need to opt in the future. So your personality matters a lot, because I call this marrying your profession, because whatever specialty you're gonna do, you're gonna keep on doing till you retire, or you have to be committed to that field. So unless you like that field, it is very hard to continue in that particular subspecialty, because medical profession is actually very tough, and you not only need to keep yourself updated, but you need to keep working hard throughout your life. So it's a lifelong commitment. So what I usually tell medical students that there are 4 subgroups or 4 main categories that you need to decide about. And the common one we all know is the clinical or the clinician category. What does that mean? That most of the doctors after the med school, they continue as clinician. The other big categories are administrative, research, and teaching. Naturally, there are some other possibilities as well, which I will touch at the end of my session today. So most of us tend to become clinician, and that's what we are taught during the med school, and after that we do training to become good clinician. But you need to be committed to your field. So when it comes to the field of choice, your personality matters a lot. It could be a medicine type personality, it could be a surgical type personality, and the main difference is your approach. You like to think and analyze the situation. Naturally, surgeons has to do that as well, but the physicians need to be more brainy in that sense, that they need to analyze, hypothesize, confirm it, and then treat the patient accordingly. And when it comes to surgery, you have to be somewhat more aggressive in your personality type and really a good decision maker, because when you are doing surgery, you may not have enough time to waste, and you have to make the decision then and there, and you have to be really upfront. So that is the personality type a surgeon should have to be a good surgeon. Then over the passage of time, some specialties has been established or developed which has the combination of both, like ophthalmology. You do medicine, but you do surgery as well, and it's a combination. Same goes for ENT or ear, nose, throat doctors, or OBGYN doctors. Beside that, there are other specialties like the laboratory or ancillary laboratory services, and some of the doctors opt to do that, like radiology, And in that case, you most of the time tend to lose the patient touch or patient face-to-face interaction. So you need to be careful when you opt for a specialty in your medical career, because based on your personality type, if you are not a personality type who like to sit in the radiology room reading the scan during the day, during the night, then it may not suit you, but someone who likes it and feel interested in it should do it. The other big category is administrative. Some people do masters in public health. Some people do American Board for Quality Assurance or other boards for quality and management, as well as the leadership roles. That make you a suitable candidate for the leadership role like medical director, CEO, and of the similar sort. Also, you can do masters in business administration or similar diploma as well beside your medical degree, because it really becomes handy when you are part of the team who's managing the financial statement of the hospital or dealing with the finances, and you can guide the hospital committee and you can be a key member in that case. When it comes to teaching, it could be the teaching of the students like in med school, it could be teaching the residents or fellows, or it could be teaching the consultants. Like College of Physicians and Surgeons of Pakistan conduct workshops for consultants for being supervisor and what to expect when you become a supervisor. It could be part of your medical curriculum in med school and even afterwards as a consultant. But some places offer dedicated courses which could be really helpful for you to guide your students and residents. The other big category is research. And if you are a research savvy or research interested kind of person, it could be lab-based or it could be clinical research. So if you are a basic scientist, then you need to opt for similar courses after your med school, during your med school, so you become a great researcher at the end of it, and you will be able to get some grants from the government or from some private bodies, and you can continue doing this because you like to do this. The other allied specialties or fields for a medical doctor could be in the field of information technology, for the medical records. It could be for the medical legal cases, for the pharmaceutical companies. So there are many other options, including medical transcriptionist, which is kind of fading now. But again, there is always new similar jobs popping up in the medical market. But I think as a medical student, what you need to learn is knowing all these information. And then as you go through your med school years, you try to find out what kind of personality you have and try to do courses which are going to support you to pursue your field of choice in the future. Because that will not only save your time, it will really keep you on track and you will be more straightforward in terms of achieving your goals. And that will really help you be successful in your area of choice. I hope this lecture will be helpful for the medical students who are getting into med school. We will try to do some of the lectures as well for medical student orientation. Thank you very much.